Hello, I'm Dr. Sushrut Tated. I'm a board certified plastic and cosmetic surgeon and I practice in Pune, Maharashtra. Today I'm going to discuss about pilonidal sinus. I'm going to show you a video review of my patient who is very happy with the pilonidal sinus surgery and its results. First of all, I would like to explain you what is pilonidal sinus. So, pilonidal sinus is a skin tag or a swelling which is usually present between the natal cleft or between two buttocks, mostly in the superior region of the buttock. Pilonidal sinus is nothing but an infection of skin and hair follicles which is present in this area, as you can see in this photograph. So thing to remember is that pulmonary sinus is mostly seen in the patient who has long hours of sitting job or profession like truck drivers, medical students, UPSC students and other civil service examination students. So treatment of pulmonary sinus is if the pulmonary sinus is in its initial phase, there is just infection or pus, then antibiotics and dressing is sufficient. But however, most of the patients approach surgeon when the disease has progressed. So mostly in these patients, surgery is only option which is remaining. So why plastic surgeon? This question is very frequently asked. Why should we get our pilotidal sinus treated from plastic surgeon? Because plastic surgeon has a dual advantage of excising the pilonidal sinus or treating the disease completely and radically, and also performing a flap surgery simultaneously so that your wound is also closed in the same setting. So normally the surgeon what they do, they excise pilonidal sinus and leave it as it is so that the wound will heal on its own. But plastic surgeon, they do flap surgery in the same setting so that your wound is also closed and the patient is normal within 15 days. So if you get treated from plastic surgeon, the recovery time is around 15 days. Now most of my patients, they ask me whether you have endoscopic surgery or laser surgery. So my answer to them that though this modality of treatment is also available, but no modality of treatment beats proper surgical procedure, because this surgical procedure has a minimum recurrence rate and high compliance as compared to other laser or endoscopic procedure. So I will always, and all the plastic surgeon around the globe will always vouch for surgical procedure rather than going for these laser surgery procedure or endoscopic procedures.
Hello, my name is Sai Kale. I am 19 years old, a regular college going student. In October 2023, I came across a problem of severe pain in my lower back. The pain was so massive that I was unable to sit for long hours for the studies and do my daily chores on regular basis, for which I consulted 2 to 3 doctors in my locality, but none of them proved to be useful for me as the medicines prescribed by them was none of my use. They just they just lower down the pain, but they didn't remove the pain completely from that infected area from my lower back. Then after few days I consulted Dr. Sushrut sir. After examining the area of infection, Dr. Sushrut sir advised us to go for the surgery, pyronidal sinus. It was the name of the disease. So at earlier, I was very tense about the surgery as it was my first surgery. I have never faced any kind of surgery before, so I was really tense about it. But Sushrut sir gave me that confidence that it's a small surgery and yes, it will be successful. So I was confident enough about the surgery. On 3rd of November, Sushrut sir did my pyronidal sinus surgery successfully. Very big thank you for them. And after the surgery, Sushrut sir's regular checkups helped me a lot. All the medicines prescribed by the Sushrut sirs have worked very well on me, and also have reduced my chances of getting disease back into it. So also a big thank for Sushrut sir, and yes, you can trust him. Thank you, Sushrut sir.
So this was a patient, 19-year-old patient who was aspiring to become a doctor. Due to his long hours of sitting and also due to most of the hairy growth which is present in that nasal cleft region. He was suffering from pilonidal sinus. He went to many doctors before coming to me, which is normally the case in many patients. And after that, when he came to me, I saw the patient and I realized that surgery is only option in this patient. So I planned surgery in which we did complete excision, and also we did advancement flap, VY advancement flap. And after the proper follow-up, and this credit should also go to the patient and their relatives for maintaining a proper follow-up. Now this patient is disease free from at least last 2 years. So the message which I want to convey through this video is that always prefer a surgery over a laser and endoscopic procedure, and always prefer a plastic surgeon or normal surgeon for treating a pilonidal sinus. So this was the review of our patient. Now if you want any information related to pilonidal sinus, please contact on the WhatsApp number given below, and you can also see my previous video, the link of which is given in the I button. Thank you very much.